I'm Cristina Fernandez. I'm one of the 4 pediatric ophthalmologists at Eye Surgery Associates. So a pediatric ophthalmologist is essentially a medical doctor that we went through med school and we decided to essentially just focus on the eyes. And more than that, we only focus essentially on kids' eyes. So we basically did all of our training. We did 4 years of med school, then we did residency, which is our essential training, and we do 3 years just of ophthalmology, and then people like me do an extra year just being trained in diseases of the eye in kids essentially. And we mainly work with anything that's related to the body and to any type of medical disease, but that's associated with the eyes. There's different reasons why your child should see a pediatric ophthalmologist. A lot of the times we have great pediatricians that will do screenings, or pediatricians that see certain things, or even the parents see certain things in kids that needs to have a medical doctor take a look that has a specialty in eyes per se, and that's where we come in. Or sometimes other doctors of different specialties want us to see kids for different problems, like patients that have diabetes, or patients that have sickle cell, or patients that have had trauma in the eye, so things like that essentially. So children should start seeing an eye doctor depending on what they have in terms of medical diagnoses or what's being seen by a parent or a pediatrician. There's no set age truly to see a pediatric ophthalmologist. So a lot of kids see us because their pediatrician refer them to us, or we see them in the hospital and then they're referred to us. Most pediatricians, especially here in Florida, do vision screening. So if you go to the pediatrician, probably around 2 to 3 years, they'll have your child do a vision screener. So they put kind of like a little camera in front of them and they're watching either like a shark or a flower, and then they'll have a vision screener saying, well, the kid has X or Y disease that might be a glasses problem or a strabismus problem, which is either eye wandering or eye crossing, and they send them to us. We also see a lot of premature babies that we see in the hospital, so we do all the NICU babies, and any child that has anything that's going on in the hospital or the ER, they're sent to us. But it's mainly people that are referred. A lot of the times parents still come and see us if they feel their child has an eye that crosses, or the eye's red for a while, or they feel their child's not being able to see. It will be more than happy to see them, but most of the time it's referred by the pediatrician. So there's a lot of different diseases that can be diagnosed through us, and it's really important for us to see patients and do their eye exam. The most important thing that we see a lot of kids for, that's the most common type of exam that we do, it's a regular visit. They're seen by their pediatrician, they fail a vision screen, and they're kids that can have lazy vision or amblyopia. So those are kids that need to be in glasses at an early age, because you develop your vision at an early age, and if we don't do that, then they won't have great vision. So that's the most common thing we do. Also, we have a lot of children that have strabismus, or an eye that crosses or wanders out, and sometimes it can lead to vision problems, so that's another reason why we see them. Also, we have a lot of premature babies that are born with a disease that's caused retinopathy of prematurity, and we see all of them in the NICU, and they can have all these different issues, and that's also a really important reason for us to see them. The other is there are different diseases that can be inflammation in your arteries, or inflammation in your veins, inflammation in your body, or even inflammation in your brain, that with our exam we can actually diagnose them. So a lot of doctors send them to us to do that instead of doing other types of invasive procedures, and they can just be seen by a simple eye exam. So there's multiple conditions that can be detected on an eye exam. The most common one and the easiest one is a need for glasses. And that can happen when a kid is 6 months of age or the kid's 17. So it just really depends on how they grow, how their eye is being developed, and what their family history is as well, even though they might not have a family history of it. There's other things like problems with redness in your eye that can be anywhere from a simple viral conjunctivitis that we can all get from the common cold, and it can be a very bad inflammation in the eye that they need treatment for essentially. Other things that can be detected in an eye exam can be crossing of the eye, which a lot of parents see in kids, and they send them to us to see if there's something that needs to be treated. A lot of these kids actually need surgery sometimes, or an eye that wanders. Some of those kids need glasses or they need surgery. So it just depends on what kind of the parent's seeing or the pediatrician is seeing. Other diseases that can be diagnosed with an eye exam can be diabetes, which happens more in adults, but it can be seen in kids early on, and we see problems in the back of the eye and we send them for testing, and that's what it is. Or problems with inflammation in your body can also be something that we can diagnose, like different type of autoimmune diseases as well. There can also be trauma. Sometimes kids fall or kids hit themselves with a toy and parents not sure what happened because kids are kids and they'll walk around and they'll be on the floor and we're not really sure what happened. We'll see bad injuries, like injuries that need to be taken to the operating room and be fixed, or injuries that just need medication, and that's it. So basically, glasses versus contact lenses for kids, it's very dependent on the child. We always give them glasses first. And most kids, that's what they'll use. But a lot of the times when kids, kind of go into the teenage years, they don't want to use glasses, or their glasses are too thick, or they're uncomfortable. And none of us probably have any problems using contact lenses. But contact lenses need to be used appropriately. So like in every adult, we all tell them you can't sleep in your contact lenses. You have to wash your hands when you put them on or take them off. So it's really important to have good contact lens hygiene. So I personally am never opposed to having a child wear contact lenses. Just has to be the appropriate age and the appropriate child. Some kids are 15 and they won't ever wear contact lenses. I have patients that are 8 and are phenomenal contact lens wearers. So that just basically depends on the patient. There are also some kids that have had cataract surgery when they're babies, and we do put them in a contact lens early on in life because they have to, because that's the only way they'll tolerate a prescription and they'll be able to see. So there are medical needs for a contact lens as well. There are also kids that have something called keratoconus. That's basically the shape of the eye is a little bit different. And contact lenses are probably the best thing to use for them instead of glasses for them to be able to see better. So it just basically depends on the patient. So Eye Surgery Associates has been around for a very long time. We've been a practice that has been around for more than 25 years, and it's always had pediatric ophthalmologists in the practice. So it's first started with Dr. Dorfman, Dr. Cardone came along, then myself and Dr. Alvarez as well. All 4 of us are board certified ophthalmologists, and we're all fellowship trained pediatric ophthalmologists. So we're essentially fairly well trained to be able to see kids. We also have a great relationship with all the pediatricians around. They all know us. We've been here forever. We also have a great established relationship with all the hospitals in the community, especially Joe DiMaggio Children's Hospital, which we're the ophthalmologists on staff. So we've been seeing kids in the Broward community and the Miami-Dade community too forever. So we're just kind of here to stay in a way.